This talk is an overview of the diagnosis of disruptive behavior and related disorders. This talk will review the diagnoses in the chapter of the DSM titled Disruptive, Impulse Control, and Conduct Disorders, with mnemonics and visuals to help you remember the criteria. Specifically, I'll talk about oppositional defiant disorder, intermittent explosive disorder, conduct disorder, pyromania, and kleptomania. All of these diagnoses involve behavior that is disruptive to others or to society as a whole. They are commonly comorbid, and defiant behaviors early in life are associated with antisocial personality traits and substance abuse later in life. Let's start with oppositional defiant disorder. ODD involves behaviors in the categories of opposition and defiance, as the name suggests. Defiant behaviors are those that involve defying rules or authority. Specifically, the symptoms are arguing frequently, blaming others, annoying others, and disobeying rules. Oppositional behaviors are those involving anger and vengeance. Specifically, the symptoms are having a quick temper, being easily annoyed, being mad or angry often, and plotting revenge. To meet criteria for ODD, the patient must exhibit at least 4 of these symptoms, which you can remember with the mnemonic a bad temper. You can remember that 4 symptoms are required by visualizing the O in oppositional, which, when imagined as a rectangle, has 4 corners representing the 4 symptoms. Also, the patient must exhibit these symptoms for at least 6 months. Let's move on to intermittent explosive disorder. IED involves verbally or physically aggressive outbursts occurring with little provocation. In other words, the intensity of the outburst is extremely out of proportion to the intensity of the provocation. The outbursts are not premeditated or planned, and they are not done for any clear goal or secondary gain. In other words, the outbursts may appear to occur as if out of nowhere and for no reason. The verbal and physical aggression is directed at any of 3 targets: people, animals, or property. Whether the outbursts cause injury to people or animals or damage to property is important to the diagnostic criteria. If they do not cause injury or damage, then they must occur at least 2 times per week to make the diagnosis. If they do cause injury or damage, then the threshold for diagnosis is lower. Only 3 episodes in the span of a year are needed. The patient must exhibit these symptoms for at least 3 months and must be at least 5 years old. Let's move on to conduct disorder. Conduct disorder involves repeatedly violating the basic rights of others or violating social and cultural norms. Specifically, it involves repeated episodes of aggression, destruction of property, lying, stealing, and rule breaking. Aggression includes threatening violence, getting into physical fights, using weapons, being physically cruel to people or animals, or committing violent theft or sexual assault. Destruction includes destroying property and fire setting. Lying for secondary gain is another criterion. Stealing can also include breaking into others' homes or cars. And rule breaking includes staying out of the home overnight, running away from home, and being truant from school. To meet criteria for conduct disorder, the patient must exhibit at least 3 of these symptoms. You can remember that 3 symptoms are required by visualizing the C in conduct, with 3 points on it as shown here. The patient must exhibit these symptoms for at least 12 months, and generally they will be younger than 18 years old. This is because once they are 18 years old, if they still exhibit symptoms of conduct disorder, they will usually meet criteria for antisocial personality disorder. Therefore, it is often said that conduct disorder grows into antisocial personality disorder. Finally, let's briefly discuss pyromania and kleptomania, which are fairly similar in their diagnostic criteria. Pyromania involves repeated fire setting, while kleptomania involves repeated theft. Neither of these acts are done for secondary gain. The fire setting in pyromania is not done for revenge, as a social or political statement, for monetary gain, or for any other secondary reason. Similarly, the theft in kleptomania is not done because the stolen items are needed for personal use or for money. Instead, these acts are done on impulse. There is a sense of tension or arousal before the act, and a sense of relief or gratification after the act. The act appears to be done solely to relieve this tension. That's the end of this talk. I hope this is a useful guide to these diagnoses. Thank you.